therapeutic uses of epinephrine. In what all scenario we can use epinephrine? Because it is acting on different receptors alpha 1, alpha 2, beta 1, beta 2. Remember, it is considered as a drug of choice in a patient with the anaphylactic shock. In a patient with the anaphylactic shock, it is considered the drug of choice. This anaphylactic shock actually is an example of type 1 hypersensitivity reaction. It's an example of type 1 hypersensitivity reaction, right? So that will be your adrenaline. Question have been asked n number of time on this topic, that how much dose and what should be the preferred route for this one. How much dose and what's the preferred route? So remember guys, you are going to use epinephrine in the dose of 1:1000, in a dose of 1:1000 intramuscular route. The dose ho gaya, route ho gaya. This is the preferred route. Preferred route, it's not IV, it's not any other route. Intramuscular route is the preferred route. We all know that type 1 hypersensitivity reaction or anaphylactic shock, oftentimes they also ask the question antibiotic induced hypersensitivity. Again, that's the same, है ना? So IM route se we will be giving 1:1000. How much you are going to take? We will be taking 0.5 ml will be taken and 0.5 ml will be injected. Okay. So examiner asks, if you are going to take 0.5 ml, how many milligram of drug has been given? So for that, in Viva also we see lot of the time examiner asks this question and student get confused that what to mark or what to say. Examiner asks, what is the meaning of 1:1000? Simple question. What is the meaning of 1:1000? So let's quickly understand the meaning of 1:1000. The meaning of 1:1000 is that there will be 1 gram of drug in 1000 milligram, 1 gram of drug in 1000 ml of water or NS. यही मतलब हुआ 1:1000 का meaning is 1 gram of drug in 1000 ml NS. Now can I also write 1 gram as 1000 milligram? 1 gram as a 1000 milligram? I think it's very simple. So we can say 1000 milligram in 1000 ml NS or 1000 ml water. कोई भी एक लिख दो, NS और water, that's the same thing, NS, normal saline. So 1 gram in 1000 ml. So 1 gram ko we can also write it as 1000 milligram. And therefore, if it is 1000 milligram in 1000 ml, we can say it will be, the concentration will be 1 milligram per ml. The concentration will be 1 milligram per ml. From this concentration of 1 milligram per ml, we will be taking 0.5 ml. So the question comes, in 0.5 ml, how many milligram drug will be injected? 0.5 milligram. 1 milligram is there in 1 ml. So in a half ml, half milligram will be there, right? Now the next question that comes, okay, after this, if the patient is non-responsive, then what will you do? Aapne diya. If it is not responding, 1 milligram per ml, 0.5 ml you have given. The range that has been given, range in the textbook, you will be finding the range 0.2 to 0.5 ml. Remember, this is the range, right? So in the pediatric population, we will be giving on the lower side, like 0.2, 0.3. So if they are going to give you a history of pediatric patient, we will be going ahead more towards this one. And in the adult, because we are not worried about more of toxicity, we are worried more about life-saving scenario. So we'll be going ahead with the adult side. So 0.2, 0.3 pediatric, 0.4, 0.5 or on the higher side will be mainly adult side. Okay. If it is not responsive, NR, that is non-responsive, then we are going to repeat the same dose again and make sure that your nursing staff or the one who is assisting you should be competent enough to find the route, because if it is again a non-responsive, same dose may again a non-responsive, then what we are going to give, we will be repeating, but now we will be giving via IV route. Now we will be giving via IV route. Please remember, it can cause arrhythmia and that can be more fatal for the patient. Therefore, we should further dilute it via 1:10,000. In one of the question, examiner asked, sir, let's say if the nursing staff, or if you cannot access IV route, then what will we do? Then I can say you can, according to recent guideline of ACLS, you can even go for the intraosseous in the same dose. Again remember, intraosseous, bone wala to kabhi bhi de sakte. you can give via bone as well, and then we can also give via the intracardiac, the last resort, but intraosseous, intravenous, intracardiac, right? So always remember the drug that it is given in 1:1000, it's always either IV or intracardiac or intraosseous. All right. Apart from this, apart from being used in the anaphylactic shock, where else we can use? Where else we can use? So A for anaphylactic shock, we can also use this in other condition like your bronchial asthma. So in the pediatric population, in adult population also, we use them in the bronchial asthma because of their bronchodilating property. In a condition like croup and all, we also use it. Okay, bronchial asthma or other respiratory condition like croup. Then we can also use it for cardiac resuscitation. Cardiac resuscitation, for duration prolongation of local anesthetic, duration prolongation of LA. LA is local anesthetic. So usually with the lidocaine we can use. With the lidocaine, with the lidocaine we can use, the concentration here will be 1:200,000, 1:2 lakh. So with the lidocaine also we can use. Now why and how it will be working? Let's say you are going to use a regional surgery, lidocaine is one of the local anesthetic agent, and if you want to make sure that the duration of effect should last for longer time, the anesthetic effect, local anesthetic effect should last for longer time, you will be giving local infiltration of epinephrine, due to which the drug will be staying in that local site for longer time due to its vasoconstricting capacity or property. Next that we have, it can also be used for the epistaxis. So for the local vasoconstriction, also we can use, but for the local vasoconstriction, the range that we are going to use is 1:80,000 to 1 lakh. So 1:80,000 to 1:100,000. Just to make it very, very easy for you, I'm just writing this numbers. So with the lidocaine, 1:200,000. In the emergency condition, 1:1000, but this 1:1000, it will be intramuscular route. Please don't make any mistake in this, and there is no scope of mistake, and you can definitely expect one question on this topic. Believe me, it is such important topic. All right. So this is about the therapeutic use of epinephrine. You can remember all the use of epinephrine by a simple mnemonic of anaphylactic shock, A, B for bronchial asthma, C for cardiac resuscitation, D for duration prolongation of local anesthetic, and E for epistaxis, right? E for epistaxis. All right. That will be different use of epinephrine. Now we can go ahead with the other drugs. Before that, this is just a quick summary of the different concentration that I told you, that 1:1000. I think we have already discussed this IM. Plus, if you want to use subcutaneous, again you can use it, but subcutaneous is one of the route which we have discussed in general pharma. It's a slow absorption, so we will not be preferring subcutaneously. Prefer nahi karte hain. Preferred is always IM. 1:100,000. It is going to be IV, intracardiac, intraosseous. We have discussed this. 100,000 like local anesthetic for epistaxis, and 1:200,000 with local anesthetic like lidocaine we can use.